Good morning. This is a convening of the Central District Board of Health meeting for Friday, August 19th, 2022. It is now 8:30 a.m. I will introduce myself as the presiding chair. I am Betty Ann Nettleton, representing Elmore County. And at this point, we'll call the meeting to order and take roll call, starting with Ada County. Jane Young.
Jane Young, Ada County.
Raul Labrador.
Raul Labrador here.
Dr. Cole. Boise County. Don't see anybody from Boise County. Elmore County.
Megan Blakesmith here.
Thank you, Megan. Valley County, Commissioner L.
Commissioner Hasbrook here.
Okay, thank you. We do have a quorum present, and so we will proceed with our action items. Director Duke, are there any changes to the agenda?
Madam Chair, no changes to the agenda.
Okay, thank you. We do have in-person comments. We do have one person signed up, Mr. Evans Jonathan. Are you present? Okay. You can go ahead and take the podium, Jonathan, and you have 3 minutes.
Good morning, Central Health Board. The summer has been very interesting with new developments regarding the pandemic. Dr. Birx admitted on national television and in her book that she lied to the American government and people about COVID-19 protocols. Senator Rand Paul held another committee hearing earlier this month with his peers and Dr. Fauci's peers, and admitted that he lied against the gain-of-function testing to Congress. Dr. Fauci also lied about the origins of the COVID-19 virus to Congress and the American people. CDC Director Rochelle Walensky admitted that her agency has gotten COVID-19 responses all wrong, and the entire CDC needs to be overhauled. The CDC Director also admitted that these shots do not stop transmission or infection of the virus. The White House COVID czar admitted 6 feet apart was not based on science. I have sent all of you in 2020 and 2021 studies from the CDC admitting that they have never isolated the SARS-CoV-2 virus. Therefore, I think that the Boise CDH owes Dr. Ryan Cole, MD, a public verbal apology and a sincere written apology on the Boise CDH webpage. Dr. Cole's medical license has had fraudulent claims made against it. I think that Mr. Duke's medical license should be in jeopardy at this time because he should resign following the fake science. I also don't think anyone in this agency deserves a raise due to the damage and harm that they've done to this community. Businesses were shut down along with schools. Parents had to quit their jobs in order to stay home with their children due to these protocols and school closures. Just like the CDC, I demand that the Boise CDH go through an overhaul of its own. The people of this district have lost faith in the leadership here. I praise Mr. Labrador and Mr. Cole for their courage to fight against the unneeded germ hysteria. Some of these things that should have been promoted are vitamin C, D, zinc, and quercetin, healthy eating, regular sunlight, and exercise, not experimental shots hiding in your homes and stop living. Recent quadruple vax to well-known Dr. Fauci, Joe Biden, Kamala Harris, Hillary Clinton, Barack Obama, Gavin Newsom, the Pfizer CEO Albert Bourla himself, and many more have been COVID positive. With this in mind, why would we trust any guidance from the CDC anymore, especially about monkeypox? This agency has its own monkey reorganization to tackle. 97% of the positive monkeypox cases have been among homosexual male adults. We should not be pushing any protocols on this. If you do make any protocol suggestions, I suggest that you make sure everybody insert anal plugs and wear condoms before entering public settings.
Okay, thank you, Mr. Evans. Okay, proceeding with the agenda. Our next item is approval from for our May 2022 board meeting. We do need a motion to approve those if there are no additions or corrections.
Madam Chair,
Yes, please.
I make a motion that we approve the May 20th, 22 board meeting minutes.
Thank you, El. Is there a second? Second. Thank you, James. The motion has been made and second to approve the minutes from our Horseshoe Bend meeting. So I'll take a vote by county, starting with Ada County. Jane Young,
Jane Young, aye.
Raul Labrador,
Aye.
Dr. Cole, Boise County, Elmore County, Representative Blanksmont,
Aye.
Valley County, Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, those minutes have been approved as presented. And proceeding on, I'll turn the agenda over to Director Duke to introduce our new Family and Clinic Services Administrator.
So we're pleased to introduce Stephanie Myers. She joined our agency 2 weeks ago, and she comes to us with over 13 years of experience working in healthcare. The majority of that time was with St. Al's, and then more recently with St. Luke's. She has a Bachelor of Science in Healthcare Administration and a Master of Science in Management Leadership from the Western Governors University. So I'll give her a few minutes to share whatever she wants to share.
Very excited to be here. Like Russ said, I have a lot of experience in healthcare leadership, mainly in primary care and specialties, pediatrics. So I've lived in Idaho my entire life, and I'm very excited to be part of the CDH team and help transform healthcare in this organization.
Thank you.
Thank you and welcome.
Yeah.
Okay, Russ, go ahead and take the introduction for Victoria, please.
Yeah, so Victoria Odell is our staff epidemiologist and lead for monkeypox, as well as lots of other things. But monkeypox is taking a front role right now from a public health perspective. So she's going to provide you with an update and let you know how we're responding to this new disease for the United States and new for Idaho.
Hi, everyone. Just waiting for Dustin to pull up my presentation, please. So I'm just going to be providing a brief overview of what monkeypox is and just talking you through the status currently globally and locally. Dustin, please advance the slide. So monkeypox is related to the smallpox virus, but it causes less severe illness. It was first discovered in 1958 in animals, and then the first case was recorded in 1970 in humans. And then it is endemic to Central and Western African countries. In 2003, though, the United States did have an outbreak. It was associated with the import of rodents for pets from Ghana. And 47 people became infected at that time before they were able to figure out the source and control it at that point. Dustin, please advance the slide. So here's a brief timeline of this 2022 outbreak. So May 6, 2023, the first case of this outbreak was reported outside of Africa. On May 18th, of 2022, the first case was reported in the United States, and that was in Massachusetts. July 6, 2022, Idaho had their first case of monkeypox that was probable. It later was confirmed through additional testing. On the 13th of July, the US reported having over 1,000 cases of monkeypox. July 23rd, 2022, the WHO declared monkeypox a public health emergency of international concern. And then on August 4th of 2022, the US declares a public health or a health emergency due to monkeypox. Dustin, if you could advance the slide, please. So the symptoms, typically people have a prodrome period where they have fever, headache, body aches, chills, typical flu-like symptoms. And then they typically develop the rash or lesions. I didn't include pictures of the rash or lesions because I didn't know. Yeah, I didn't know everyone's comfort with that. I decided to forego that. In this current outbreak, we are seeing individuals either not have any of the prodrome symptoms or having them after the rash develops. The rash can be very painful and there is potential for it to leave scarring. Next slide, please. So the incubation period from your last exposure is up to 21 days. People are typically seeing symptoms within 2 weeks after exposure, but there is that full 21 days that we would want to watch for symptoms if you were exposed. Someone is considered infectious until those scabs, or excuse me, until those lesions have scabbed over and the scabs have fallen off and there's fresh skin underneath. So there's not a definitive timeline on when someone is infectious. It depends on how everyone heals and how severe their illness is. Next slide, please. Transmission is typically through direct physical contact with someone who has the rash or lesions. There's some evidence that it can be spread through prolonged face-to-face contact. We're talking about 3 hours or so, so quite prolonged contact for any respiratory spread. There's also, if you come into contact with the scabs or the bodily fluid, there's potential for spread that way. And then if someone in the household, say, had monkeypox and someone else washed their sheets, there's potential for spread that way, or just any used garments. It's also possible to get infected through animals, scratches, bites, or eating infected meat. Right now, monkeypox is not endemic in our animals in the United States, so this isn't really a concern here. And we're working to try and keep monkeypox out of our animal population so that never becomes a concern. Next slide, please. So there's 2 vaccines available. There's the ACAM 2000, which I didn't put up here because it's not being used right now by the United States. It has a lot of contraindications for giving it. If you have even eczema, they don't recommend that you get that one. And then if you're pregnant, if you're breastfeeding, there's just a lot that says you can't get that vaccine. So what is being used is the Jynneos vaccine. It was approved by the FDA in 2019, and it's a 2-dose series given 4 weeks apart. There is a grace period. You can give it about 24 days to 35 days apart. And then you're considered fully immunized 2 weeks after that second dose. Typical side effects people are seeing are kind of what you see with any vaccine, where you feel kind of run down, maybe some aches. But the biggest thing people are reporting is some pain or redness at the injection site, which is very common for any vaccine. Next slide. Thank you. So right now, I pulled the data on the 17th at 3:15 p.m. Just so that it would be ready for this board meeting. Globally, there's 38,019 cases. Of those, only 387 of those cases have been reported in areas where they have already seen monkeypox in the past. All the others are in countries where normally they don't see monkeypox. The United States had 13,517 cases. With 9 of those being in children. Right now, all the cases in children, except for 1, have been associated with the parent having monkeypox, so then the child having close contact with the parent. There's 1 they are investigating in Texas right now that they don't have a cause for, but the child doesn't go to any public daycare, hasn't been in public school, nothing that would cause concern for community transmission. Idaho currently has 9 cases, and 8 of those are in Central District Health jurisdiction. And that is all I have right now. I am open to any questions.
Madam Chair.
Yes, so go ahead.
Victoria, where's the last case? It's not on CDH. Is it here in southern Idaho, northern Idaho?
The most recent one in Idaho was here in Central District Health.
You know, you have 1 out of 9 that are not in CDH. Where's the other
Oh,
one?
yes, sorry. The other one is in District 7, which I can't think right now where that. Yeah.
Falls.
Thank you.
And then the other question I had is, do you know what they're going to rename the monkeypox?
I have not heard what they're going to rename it yet, but thank you for bringing it up. The World Health Organization is working on renaming monkeypox, but nothing official has come out yet.
Thank you.
Yes.
Any other questions or discussion points? Right?
Madam Chair.
Yes, Doctor.
So are we tracking the most common cause of spread with the individuals in terms of, we know the great majority around the world, 98% plus has been men who have sex with men.
Mhm.
And about 41% of the individuals worldwide thus far have been HIV positive, so they're immune suppressed. So I just wonder if we're tracking the same in Idaho and tracking their partners, et cetera.
Yes, we are doing that as part of our investigative process.
So, Madam Chair, so Dr. Cole, if a person has HIV, they're more susceptible to this?
Just because of immune suppression, they're more susceptible to any infection.
Thank you.
Any other points? Victoria, thank you so much.
Thank you.
And it's nice to meet you.
Yes, wonderful to meet you all.
Thank you.
Thank you.
Okay, proceeding with our agenda, it looks Laurel, a lot to say this morning. Agenda. Okay, I will turn the financial report over to you.
Thank you, Madam Chair. And I always like to start out this August meeting with a thank you to our finance team, because it's kind of the culmination of the work that they've done throughout the year. So I've got Bailey Peterson, our financial manager, behind me, who's done a tremendous job this year. She leads a team of 4 in addition to her, Conan, Patty, Corolla, and Leanna, and they just are a dynamic team that do a great job with really good attention to being financial stewards and always looking for opportunities for efficiency. So thank you, Bailey, and your team for all the work this year. And we'll go ahead and go into the presentation, Dustin, Scott. Actually, Dustin, that's page 2. If you could go back 1 page, please, I would appreciate that. So this is a summary, thank you, of our financial position for the end of the year. Everything continued to stay on track with where we were from the last report. We ended in a good financial position. Our revenues were greater than what we budgeted, coming in at 112% of budget. And then our total expenditures continued to remain under where we budgeted, coming in at 97% of budget. We do a little bit of a deeper dive into the revenues for the year. We can see that for support services, our revenues were over what we budgeted. That again was on track with what we saw through the year. And it's a small number. It shows 265%, but you can see it's just $17,000 that we're talking about. And that came from rebates, surplusing vehicles, the same things we've been tracking throughout the year. For community environmental health, we ended up over where we planned for both fees and contracts, and about 80% for our other revenue. And that's part of that was because WIC revenues were under what we'd planned. For family and clinic services, same trends continued there. Our fees were under our budgeted amount. And then both for other categories, contracts and other, were over what we budgeted, coming in at a total of 110% over budget. 10% over, 110% total. And then looking at county contributions, that shows at 90%, and that's just a timing issue from when we receive county funding. So we do end up where we're supposed to be, but with the end of the fiscal year and the timing, it shows at 90% on this report. That's a little bit deeper summary of revenues. Looking at expenditures, administration came in at 94% of budget. Support services, our personnel was slightly over at 108% of budget. That's partially because of the grant writer position that the board approved as one of our special projects, which has been very successful, by the way. And then community environmental health was under in personnel, over in operating, and we saw that same trend in family and clinic services being under in personnel and over in operating. We did have some expenditures at the end of the year, some training costs and things that pushed that operating a little bit higher, but kept personnel where it was.
Chair,
Yes, Megan.
can I ask a quick question?
Yeah.
Are we under on personnel just because we're understaffed?
Yes, so there's 3 contributing factors there. We've had vacancies, continued turnover, and I had one other contributing factor there. Yeah, I think for personnel, yeah, the salary savings were vacancies and the continued turnover. And then back to, so then looking at the overall salary savings, we saw them last year and again this year, 10% under what we planned. So that's quite a significant savings in our personnel. Moving on to page 2, the second page, this is always our same numbers, looking at them a little bit differently with the comparison of the past 2 fiscal years. Community environmental health continued the upward trend that we've been seeing, but you can see that it slowed a little bit from fiscal year 21 to 22 compared to the increase that we saw from fiscal year 20 to 21. For family and clinic service, we did have an increase compared to the past 2 years. And one thing that I wanted to point out there is you can see that the child dental clinic, those revenues did increase back to their FY20 levels, even though we'd seen the lull in FY21. So it's good to see that back on track. We'd seen it trending that way, but I didn't know where the numbers were going to end up. And then also in family and clinic services, our contract revenue increased. And if you look at personnel costs on here, again, you can see that we were 10% under and our operating costs ended up a little bit over. The other thing I want to point out on this, under our contracts for community and environmental health, you can see that we did go back down just under 5 million there, and that was from a reduction in the COVID funds. So it's still far greater than where we were in FY20, but not as much as we got during the high of the pandemic. Okay, and then moving on to the June cash balance statement. We were left with an undesignated cash balance this year of 1.4 million. It's less than what we had during last fiscal year, but still more than we would have in a typical year. So contributing factors to that, we had salary savings, as we mentioned. The reserve fund designated projects did not all get completed. We'll go over those in a little bit more detail. And the summary is basically our funding continues to grow and our staff has not grown or been retained at the same rate. So we see that show up no matter how we slice the numbers and look at them. So the top of this report shows that the FY22 year-end cash balance was just over 7 million. Reducing that by our cash balance, the total of the designated reserve funds leaves us that undesignated cash balance of 1.4. So looking back at the projects that the board approved last year in the special projects and carryover designation, you can see that there's only 2 projects on there. The top line, the FY21 completion of the Boise office remodel, did not get expended at all. And then the other one that did not get expended at all was the environmental health system upgrades. So when we do our carryover request for this fiscal year, we'll be asking to carry only those 2 projects over. So I wanted to point that out now that we didn't have any expenditures to those. The good news on that is that the office remodel is happening like right now. We do have the furniture being delivered next week. We're going to commandeer the Huckleberry rooms for a staging area and be able to complete the remodel for the 3 areas that hadn't yet been remodeled by the end of this calendar year and hopefully in the October-November timeframe. So good news is you will see that go down. I know I've said that before, but we continued to have issues with spacing inside the facility. And then we had some supply chain issues with actually getting the furniture here. So it's all on track, will be happening, but we're going to ask to carry that project over. And then the other one, the environmental health system upgrades, that one's been put on hold. We've considered, instead of modernizing and rebuilding our own system that we've been using, potentially buying an off-the-shelf product for our inspections that we do in environmental health. So still deciding and looking at what the state's doing for that and what the other districts are using before we make a decision and commit. We didn't want to put money into one and then realize that the rest of the state was doing something else and end up stuck with with what we got. So we anticipate making that decision and seeing some progress on that within the next few months. The rest of the projects did begin to get spent, not what we had planned, and you can see that our IT operating budget, we did end up using that completely. We migrated all of the way to Office 365 and have had some other IT efficiencies and projects. The grant writer, as I mentioned, on track, making some great progress with our grant submissions and that we're receiving. And then the other projects too are half a position for administrative assistant and the NFP program are all on track, and our NFP program got officially approved. So that's hiring a couple more positions for that now as well. Okay. And then we've got our total restricted funds. Those came in about where they have been, about 235,000. And again, that leaves that cash balance undesignated at about 1.4 million. I will stand for any questions or comments that you may have, and then I will pass it back over to Russ.
Laurel, are we starting to see a downward trend in land development with interest rates during the year?
It has slowed. We've heard that just in the last month or two that they're beginning to see it slow. typically slows this time of year anyways, going into fall and winter, but even before that, they've begun to see a trend of slowing, yes.
Bill, how about you up there?
No, we're exploding up there. We had 4 subdivisions, I think, 2 weeks ago, and we've got another giant one, 380 lot sub, kind of west and north of Donnelly. That's gonna be, right now, it's planned for 8 residences per acre. It's gonna be like a townhouse complex. It will be on central sewer and water. Tamarack is putting up 2 employee housing Quonset huts this year that are gonna hold, I think, around, could be wrong, I think it's 150 employees each Quonset hut. That will be on central sewer and water. Lots of 8 and 10 lot subs, 40 acre, 80 acre parcels. We've got 4 developments up Gold Fork that are on an unplowed county road that are all gonna be private roads, private drives on their own sewer and water. And I think it hasn't slowed down much at all. In fact, what we're seeing now is the cost per square foot is actually starting to drop. Because guys are looking for work, contractors are looking for work, and so the costs are getting more manageable. But of course, there's a lot of opposition from a lot of folks out there that don't want to see any more growth, but that's just a natural human behavior. But we're going gangbusters. And the way we watch that is we look at building permits. If you go and get a building permit and then decide not to build, you can go back in and get a refund on part of that permit and suspend it for a year or 2 years, whatever you desire. We were getting a few of those cancellations, but now those folks are coming back in because the cost per square foot is starting to drop. And so I think we're still going pretty heavy. And then I do have a question for Laurel, Madam Chair.
Yes, go ahead.
Laurel, on the grant writer, that's 75,000. I'm not sure you're gonna find anybody at that price. I hope you do, but grant writers are kind of rare and hard to find. And we've got 1.5 on staff right now, and they manage, of course, you get 10 or 11% of that administrative fee comes back to their salary. So I would hope that in your interview process, if you find someone you think is a good candidate but wants more money, keep that in mind, that you get to keep a lot of that administrative fee to pay for those. They usually pay their way, I guess is what I'm saying, but they're a hard person to find. And I can tell you it's well worth the investment. It's helped us out dramatically up there for a lot of county grants.
Madam Chair.
Yes, go ahead.
Yeah, we actually we did hire a grant writer. Maybe at a future meeting, we can introduce him to you. And he reports to Laurel, and we've been very successful so far, including a recent $2 million grant for Valley County for continuing with the opioid response. So again, he's done really well. He's helped us with our Ada County American Rescue Plan Act proposals that started late last fall, but they're finally under consideration. And now you probably recall was part of our budget this year that was up in here. We haven't come to a conclusion just yet, but Ada County is reviewing that. And yeah, you may have others to share, but he's done a really fantastic job.
And this person is just only for environmental health and financial services?
No, it's primarily
Everything.
Yeah.
Okay.
Very little on the support services side, but on the community facing programs is where he's investing this time.
And on the ARPA funds, are you going to put together basically a list of wants, and then are we going to go through that? Or who's doing that function? Who's making that determination?
Madam Chair.
Yes, go ahead.
So we had submitted, we received ARPA funds from the state, like for parents as teachers, as an example. And that wasn't something that we specifically asked for. Those were funds that came through the Department of Health and Welfare. And we have a lot of programs we provide with right, we got a world of acronyms, McV funding. And so this was money that came to us in addition to that. So that came through the Department of Health and Welfare. The only county that offered us the opportunity to apply for their ARPA funds was Ada County. So we had submitted our request at the end of November. And then they moved forward with funding internal projects first. And then there's just been, honestly, they've had staff turnover, just like we've experienced, and it's taken a bit longer than we anticipated. So we did go and present to the commissioners, and I'm not sure when they'll make their final decision. So we just have a list of projects like Parents as Teachers, Nurse Family Partnership, harm reduction. We were working with family advocates to help. They actually had a request that came through us for the commission's preference. Yeah, there's a list of projects that we've submitted.
Madam Chair,
Yes, go ahead.
I know we talked a few years back about trying to expand the Parents as Teachers program into Valley County and some of the rural counties. Is that a possibility with some of this ARPA funding?
Madam Chair?
Yes, go ahead.
So the state ARPA funds, yes, Ada County ARPA funds will only be used for
Ada County.
Ada County. We do offer Parents as Teachers in Elmore County, and we just started offering Parents as Teachers in Boise County. We were able to hire somebody from Boise County, which is awesome, from Idaho City area. And we're still working on Valley County. The challenge, as you know, is if staff person's here, it's a 2-hour plus drive. So we're trying to work out the same.
And it's all under construction.
Yeah.
Construction, 2-hour plus, yeah.
But our,
Heavy on the plus.
yeah, that's on the day, the weather.
Mm.
So our plan, what we've done, and Stephanie's, it's under Stephanie's supervision, is we had gone down the path of trying to hire staff from the community for our clinical services, which is ultimately what we've done. But we brought 2 staff on, Meg Fitzmaurice, who you know. So they're employed in the community, but they're also working for us part-time. So we're looking at a similar model, just like what we did with Boise County, where we hire somebody from the community, but most of our work will be part-time just because of the low population of permanent residents who would benefit from the services. So that's our plan. And while we're talking about it, we just got approval, Nurse Family Partnership. There's a pretty extensive process to go through to be able to use the Nurse Family Partnership name, and then our staff will go through the training. So we hired they're all bachelor's prepared registered nurses. So we have a manager, and I think record timing, she got approval for Idaho, for Central District Health, to use Nurse Family Partnership. And then our staff will go through the training, and I can't remember, I think we're going to start with 2 BSNs that will work for Leanne Somerville. And I think we just put an offer that was accepted for one of the 2 so far. So we're excited about that too, because again, as we'll be talking about next, as far as our wages are continuing to lag behind, and it's very difficult to compete with healthcare. Although Stephanie joined us, so that's a starting
Madam
point.
Chair, I have
Yes.
more question, I guess. The other thing that I think we're really pushed up against, especially in Valley County, is paramedics and paramedic training. It's pretty darn expensive to send those guys out for a year to learn to be paramedics, and I don't know if there's any program or funding for
There
that.
is, I can answer that question.
We would love to see that. I know in Cascade, Fire and EMS, they are actually going to go for an override this fall to try and financially get enough money stashed away that they can send folks to school to become paramedics. That's the only way we can afford to get it done.
Madam Chair. Yes, go ahead. We actually funded the program this last year, so legislature put more money into EMS training, and it is specifically targeted toward rural areas, so
Great.
that is available.
So maybe what I can do is shoot you an email and you
Yep.
can send me a contact.
Well,
But I think I know all the stuff I've read on places like Australia and New Zealand have more paramedics than they have jobs for them, because they educate, and they train them all the time. And it's a government funded, they pay for it, And at least this part of Idaho, we're really short on that. And it's caused a lot of distress in EMS, a lot of, used to be volunteers now. And they've all just said, I'm not volunteering, I don't have time to volunteer. So we're losing those kind of personnel. We've been working on that. So that's good. I'll get ahold of you and see if we can find some money for those guys.
Thank you, Megan. No. So. Any other points of discussion? Laurel? Okay, hearing none, we'll move on to the fifth item on our agenda, which is discussing pay increase for staff. And I'm going to turn that discussion over to Russ.
Thank you, Madam Chair. So we had a conversations this past spring as we were developing our budget. The board ultimately approved a 3% increase from our counties, which our counties unanimously approved at the May 20 meeting. And I know it will come as no surprise to you what's happening around us as far as we used to have to compete more with the private sector and nonprofits as in St. Al's and St. Luke's. And now we have a lot of the local government employers like Ada County recently provided their staff 5% increase, and then everybody received an additional $1 per hour increase, plus they made adjustments and promotions, and I'm not privy to exactly what they did. Canyon County, that was recently in the news. They're proposing, and it seems like they have support from the commissioners, to increase all their salaries, all staff salaries by $5.70 per hour. A lot of the health districts around the state this last go around did something similar, just like the state did with the 5% increase and up to $1.25. So what I would like to do, Laurel, Bailey, and I worked a lot on this to try to figure out to make sure we can financially do it and sustain it long term, is to provide our staff, every staff person who's employed by us today, with a $1 per hour pay increase effective as soon as we can process it. I think it should help with turnover. I know keep waiting for that to happen, but it hasn't. And you know, I appreciated the board's approval of the raises we did this past spring that went into effect in staff received it in June for ongoing. And this is something I feel very strongly about as an opportunity to recognize our staff for the work that they're doing, and also as a means not only to retain our existing staff, but as the salaries go up, we'll be able to bring new staff in at a little bit higher wages than we've been doing in the past. So that is my request to the board. It's an action item. Glad to answer any questions.
Madam Chair?
Yes, go ahead.
So you're saying the turnover rate hasn't changed at all and the retention rate remains the same? You haven't, nothing's budged,
It's,
or is it getting worse?
I feel like it's about the same. It's about 20% turnover. And that's more than double what we've ever experienced. And if you have that, Laurel, one of the things that I'm seeing is we have always had, I think a lot of organizations, kind of our frontline lower wage staff, they gladly leave for 50 cents an hour. Since we last met in May, Rachel Garceau left the organization. At that meeting, I informed everybody that Gina was leaving. She was at that meeting in Horseshoe Bend. And then Jamie Annenson, our division administrator for community and environmental health, just resigned. Her last day was Wednesday, and she's moving back closer to home in Oregon. But again, how do we keep the staff that we have? So point being, it's used to be primarily frontline, low wage, and now it's across the organization and feels pretty continuous.
Madam Chair,
Yes, go ahead.
Russ, did your medical insurance premiums go up much this year to cover these employees?
No, not for like our staff aren't having to pay anymore. I
Okay,
mean, the
okay.
premiums change a little bit, but it's not of significance to, I still think, as we've talked about, we have really good benefits. We have Percy with the pension. But I'm telling you, staff aren't, I can talk till I'm blue in the face because I do periodically with staff who are talking about leaving, and it doesn't matter. We all know that's a significant benefit. But for staff who are faced with, $1,700 a month rent for 2-bedroom apartments and houses that are, $500,000 and $600,000, and I know that's starting to cool a little bit, but it's still incredibly expensive. They're not looking 30 years out, they're looking at today.
So this dollar an hour per employee, how much is this total?
So it'll cost us $287,000 with benefits.
Chair question. So this is a dollar pay increase across the board, every single employee. So you're talking, but what you're essentially losing, what I'm hearing is you're essentially losing middle management.
We're losing
Or if you're.
everyone.
Because a dollar means a lot more to the guy on the front line than it does to your middle management, so.
And that's the whole, that's kind of the concept, and I'm sure that's what the legislature looked at is, so if you look at a $15 an hour, what percent increase is it? And we just decided that it would be something we'd want to do just across the agency. I mean, see where you're going. If somebody's making $40 an hour or a clinician's making $50 an hour, nurse practitioners, it's less of an increase for them percent wise, but I think budget wise, it's something that we feel like we can do and hopefully get our exit.
Well, that's why I was asking where you're losing people off this way. Because the operations you just listed off to me are more of the middle management
Right.
type thing rather than who's out front.
So we are losing, I'm sorry, I wasn't clear on that. So we're still losing our frontline staff at a really high rate, but it's also etched up into middle and upper management.
That's what I was trying to hear.
Madam Chair, so you're
Yes.
talking about salaried and hourly employees both?
Madam Chair.
Yes, go ahead.
So all of our employees are basically hourly. So we pay them by the hour. So if they work overtime, depends on where they're at, they would earn comp time or they would earn pay, just as an example, but we don't have the typical salaried, and doesn't matter how many hours you work. Executive leadership team, including myself, Stephanie and Laurel we're
So,
equivalent of salaried, right? So,
but you're talking about a raise for both groups?
I'm taught, yeah, not for me, for our staff up through our executive leadership.
Oh, up to executive, so that won't, okay, right. Well, I can tell you in our situation in Valley County, we went for a 4% raise, but our medical premiums went up 9.5%. And which was more than the raise. So we covered that plus a 4% raise just to keep staff. It's happening everywhere. I might suggest, and maybe you've already done this, is a salary survey, comparing yourself to other districts to see where we are on that. You can learn a great deal on some of that information as well, but that's going to cost you some money. We did that with PDPA here, what, 5 years ago?
Yes.
6 years ago?
We did. So we hired a consultant to do that for us this past spring. And they looked at primarily the healthcare market with
Okay, that's right.
200-ish employees. And that works pretty well. The challenge you have is a lot of our staff are very unique to our organization. Like Victoria, as a staff epidemiologist or environmental health specialist. So when you look at environmental compliance officers at St. Luke's, for example, they're doing a very different function than going out and doing food inspection. But we did the best we could to match them up. And there were some positions that were behind, and we did make some additional adjustments besides the 3% cost of living and then 1%, 2% based on solid and exemplary performance. So we're going to continue to make those adjustments for, it seems like there was about 4 or 5 positions that fell into that below market category from our salary assessment. And not that we do it every year, but if things continue at the rate they are, I think we'll want to look at reassessing our salaries probably in 2 years. And it won't be as expensive because if we use the same company we've worked with, because they already have all the data. That was the getting all that set up and figuring out the comparison positions in the external market.
Madam Chair, I guess one of the things that's going through my mind is maybe this could be something that I could promote with the executive committee and all the districts could help pay for it.
Madam Chair.
Yes, go ahead.
So we did look at like what other health districts have done, and as often is the case, it's all over the board as far as what they said. There were some districts that raised all, so salary ranges go from, there's a midpoint and it goes from basically 70% of midpoint up to 130%. We made a decision quite a few years ago to not bring our staff in any less than 80%, which would be higher than the low end of that salary, just because that's a statewide assessment and decision, and we knew we're in a I think the most competitive market in the state here. Now, that's changed a bit too, just because the cost of living's gone up kind of, well, everywhere in Idaho. And I know Carol Morley, who you all know in District 2, and they're having the same thing, just a ton of staff turnover, and that's in Lewiston, Idaho, just where their main office is. So we already had that policy of 80%. Some districts said move all of their staff to 85%, and then would give raises on top of that. I know one district that hired no less than 90%, and that's new. So they moved everyone to 90% plus pay increases on top of that. So it's not consistent, but.
Well, and you make a good point that we're really competing against the local medical than our other districts.
Yeah.
We're competing with District 3 now because they made salary adjustments too, and we've recently lost, I can think of three staff in the last month. We've lost to Public Health District 3, which is based in Caldwell. A lot of our staff, because of the cost of living, live over there. So it
Makes sense.
Well, and Ada County gave 5% plus $1 an hour, didn't they?
That's right.
Yeah.
In Canyon County, like I mentioned, I have no idea if that's going to go through or not. I was probably as surprised as anyone to see they're planning to give their staff $5. Well, it's $12,000 a year, but equivalent to $5.77 per hour pay increases. And that's not necessarily a competitor of ours. It's county government that.
Do you know, did they pay their medical increase premium too?
I honestly don't know the detail. I just read it in the news. I don't know if that was like 2 weeks ago. And I don't know that that's been approved yet. That was in conversation, but it appeared as though it had support from the elected officials.
Madam Chair,
Yes, Judy.
it becomes more urgent because it seems to me like it's harder and harder and harder to find. It's not just, part of it's retaining them, but if you did lose them, then trying to find anyone out there. Partway meet the qualifications.
Right.
So we've got to have to.
We are running into that. Victoria's team has been without a supervisor, and we have not had, applicants who are really qualified for that position to date. So it's not consistently that way. I do feel like we've been pretty fortunate that we're still able to recruit staff. It's really on we have plenty of people turn us down based on the salaries we offer, and we offer salaries that we're always looking across the agency. You're not going to bring a new employee in at $2 more an hour than somebody that's been here 5 years. I'm not going to do that. So we've had a fair number of job offers turned down because of salaries, but we're still for the most part, I mentioned the epidemiology, communicable disease controls section manager that we have not had luck filling that position. And then there's others as well, the Valley County environmental health specialist senior. So Mike Reno's got lots of experience driving that road.
Yeah, and I've been looking hard for a place for him to lease summer, but it's just impossible up there. But I think by next year, that situation is gonna change.
We hope, and we do have a person from out of state. We have been in discussions with them. Are you familiar with Valley County? Are you familiar with the housing market and things like that? And I believe that interview yesterday.
Yes.
Yeah, so we may have somebody, and timing would be good, right? Because we got all the training and things to do throughout the winter when the land development, that's the most complex part of the job. So hopefully that'll work out and we get them on board. But we did offer and have been, if you're out of state, moving expenses and things that we haven't typically done. And it's just trying to create more incentives to get people to accept the job. And then the retention part's the rest of the story that's been a real challenge. And I'll just say, when you think about a $1 an hour increase, the budget impact, clearly that's a concern, is once you make the commitment, well, what happens down the road? What happens if we go into a recession? What happens if we lose funding? Well, I would work with the board to dial things back, just like we've done during other recessions. During the 2008 housing recession, we gave no pay increases for 2 years in a row. And we asked for no increase from our counties. So that's what we do. And I just don't want to, pause on this and continue to experience what we've had based on what might happen down the road. It's not, you could ignore that. I don't think that's appropriate by any stretch, but we are keeping a close watch on that, and we'll make adjustments as we need to. And back, you recall.
It's no fun going backwards, though.
Well, I'm not suggesting we go backwards, but it's what pace do you advance? I mean, we did run into the situation with Valley County environmental health specialist, and in a recession we had two people up there, and then we had to furlough them one day a week, and it worked. We got through it, but I think that layoffs and furloughs would be the worst case scenario. Never going to reduce staff salaries.
Unprecedented growth brings challenges.
Indeed.
Madam Chair,
Yes.
I would like to make a motion that we authorize the expenditure of a $1 per hour increase for all hourly employees.
Well, is there a second?
Second.
2 seconds. Okay. Is there any further discussion? We have a motion and a second.
I just have one comment.
Yes.
I assume you're doing this, but I just want to bring it up, in-house training for people who might be underqualified for the position, but you can train on the job. Because I know that's going on private sector across the board.
Madam Chair?
Yes, go ahead.
Yes, we are. We bring people in. I think we kind of call it an underfill. So they don't
Right.
yet have their registered environmental health specialist license. We hire them, we train them, and then we move them into we bring them in a lower level job classification. They know it. And once you pass the REHS, then we can move them up to the next level. Yes, so we definitely do that and bring staff on who aren't. We're not going to have them doing inspections until they have the qualifications, but we do take the time to train them.
Madam Chair?
Yes, sir.
So Russ, do we have a budget for training?
Yes. And it comes out of, and that's kind of the complexity, but it's also a good thing. We have so many funding streams coming in. We have county money, that's one funding stream, but then outside of that, you have all the different fee revenue, from food establishment license fees to septic permits to immunizations. And then I should know this, but I'm not sure. We have probably about at least 30 funding streams coming in from Bailey. You probably would be the one to.
Yeah.
From the Department of Health and Welfare, Office of Drug Policy, DEQ. 25 active grants.
So there's a portion of that goes into training?
Yep, depends on, if it's for immunizations, and we would charge to those grants, as well as we have district funds that used to be state and county. That's now primarily county.
The reason I bring that up is I think some of the counties are gonna wanna see that in a budget for training. It makes it easier to come back and ask for money the next year if we know that you guys are training people like Megan to take over. Those kind of things, that's important. No, this, or Stephanie, sorry. You know, to be the head boss on that whole department. I think that's important. So that we can see, yeah, they're planning to do this, or are training their people, and this is their goals. Okay.
Any further discussion before we call for a vote? Hearing none, I'll start with Ada County. Dr. Young,
Yeah, I,
Raul Labrador. I think he's on.
So we still,
He's on mute.
Dr. Cole,
Dr. Cole, aye.
Boise County is absent. Elmore County, Representative Blanksmont.
Megan Blanksmeyer.
Valley County, Commissioner Hasbrook.
Commissioner Hasbrook,
he's off. He's off.
He's on.
I'm on now. Sorry, I couldn't unmute.
Oh, okay, we were just taking a vote on the motion on the salary
Yeah,
increase.
I heard aye.
Okay, thank you, Raul. Okay, that motion passes. And we will move on to our sixth item on our agenda, which is to discuss a retention incentive plan. And you take that,
Sure,
okay?
thank you.
Mhm.
So this agenda item is not an action item, but it is included in the cash carryover designations that Laurel will present to you next. So I've mentioned this in the past, and again, this is a retention strategy. I know some private sector businesses do this. So essentially what it looks like is we create a designated fund for a retention incentive. And if the board approves that, and I'm present what I like to do, and you guys can modify it or whatever you would like, and when Laurel does her presentation. And so what it looks like is we say to our staff today, if you're employed today, and I have it structured with, if you're here 6 months or less, on the payout date, which I'm proposing would be December 23rd, that's a pay date of this year, that if you stay with us, you get this certain dollar amount if you're still with us at that time. And then set it up for next December. So there's always 2 years out. Once the board makes that commitment and that money's designated, anybody that's still here would get paid that amount of money. So what I would do each August, as long as we continue to face our hiring and retention challenges, is I would propose this to the board. It would have to be money that we'd have available, which all but 1 year since I've been working here, we've always had cash carryover because we budget expecting some turnover and salary savings, but we don't budget so thinly that we end up in the red. So we've always ended up in the black for this meeting for the last 15 years. And that's worked for us. And we do various things with that money, and the board may have certain interest as far as where we would want to designate those funds. We always do that at the August board meeting. So this would be a new concept that the board, you would commit to this December, and then the second part of that would be next December, because it's further out. So if I stay, I get a larger retention incentive. That's the point. And next August, we'd have the same discussion for the following December, if we had the money to do it, and if the economic circumstances were such that we could do it, and it made sense from trying to keep our staff on board. So my proposal is on December 23rd, if you've been with us for less than 6 months, you get $500. And I'm sure you're thinking, well, how's that retention if you've been with us less than 6 months? And I kind of struggle a little bit with that too, but we are losing a lot of staff. They come, they work for us for like 2 or 3 months, and then they're gone. So it's more a matter of we're we're gonna give you 500, and then if you've been with us between 6 months and 3 years, it's 1,000, and then people who've been with us for more than 3 years. And that seems, I don't know if I call it the magic number, but once you keep somebody beyond 3 years, they tend to stay, and I think they see the value and start to see the value in the benefits and Percy and things like that. So they would get $2,000, and the cost of that for year one, and this is one-time cost, maximum would be 254,000. And the reason I say maximum is if everybody stayed, not one single employee left between now and December, that's what it would cost. So likely it will be something less than that. And that money just goes back into cash and would be available next August for the board's consideration of cash carryover designation. So again, it's an idea that besides the increase that you just approved as a mechanism, put a carrot out there a ways, and if you don't get it unless you're here on that date.
Madam Chair, a couple of questions.
Yes, go ahead.
So you'll pull Social Security and Medicare and all those costs out of this? This will be come right out of payroll, or is this a full $500 check?
It would be reduced by taxes.
And so your payroll is okay with this?
It better be, it's the law. Yes.
Yeah,
No, I mean, sometimes payroll doesn't want to deal with it.
In my world, I don't care what payroll wants to deal with. It's their job and this is the law.
we, a long time ago, talked about, trying to figure out how you get $500 in somebody's pocket.
Yeah.
But it's really impossible
It's
to do because of
impossible.
everybody's unique circumstances. So they wouldn't get 500, they'd get whatever their tax situation is, benefits and things like that.
Madam Chair,
Yes, go ahead.
the other thing to think about too is, and I know I talked a little bit earlier about your medical insurance costs. And what we've done is we started out at 60%, 40%, where we would pay 60% of your dependents and you would pay 40%. And we reduced that, now we're 50-50, but that's a really great incentive too, to keep people on the, we will pay more of your medical insurance.
Madam Chair,
Yes,
so we're on the state of Idaho's health insurance plan and
That's all
structure,
different, yeah.
and so we don't,
More.
not saying we
Yeah.
could do that, but it
It took so much effort to keep that way, so if you would just leave that alone.
Yeah. I can
I
understand.
truly appreciate that.
I'm good leaving
Yeah,
it.
I can understand. Counties is all different. We're on
Just
gym
saying.
plan. It goes up and down quite a bit, so that won't work here.
Right, and what Representative Blanksman is referring to is there was House Bill 316. It seemed relatively simple in concept, and it created a fair amount of work for certain legislators to help us.
Well, they need something.
Yeah, all right.
There you
Yeah, yeah.
One more question, Madam Chair.
Yes, go ahead.
We get down the road 4 or 5 years and everybody is happy with their job. Are we going to continue with this?
Madam Chair?
Yes. Go
So
ahead.
that's what I think is good about this plan. And my preference is we do it, fund it for 2 years to start. And then we're always funding about 1.5 years out, making that commitment to employees. It will end, and it makes sense to do so. And that could be everybody's happy with their job, our turnover is less than 10%. It wouldn't be necessary anymore. But the board is not committing, would not commit either through this year or my preference this year plus next year, and it'd be paid out in December. Next August, I'd be having the same discussion. You're not committing beyond December of 2023. And if we decide to end it, we may not even propose it. It's a fund designation. The fund is there, and you all would decide each August whether you funded it or not and what amount. And again, it depends on whether you approve just through this December or this December plus next December. And like I said, I would prefer it be through next December, So that each year, we're just having a conversation about a year and a half out. If I stay, I get the money. If I leave a day before whatever that December day is, I don't get the money.
Madam Chair.
Yes, go ahead.
Okay, so question, maybe I'm off here. You said for the first shot, right, we're talking about 254,
Correct.
okay? And you have on that we're gonna get to employee retention at 520. So have you put the dollar pay increase in there, or why are we putting 520 in the employee retention as a carryover when what you're saying is we're revisiting in August?
Madam Chair.
Yes, go ahead.
So that amount includes a retention incentive for to be paid this December and the retention incentive to be paid next December. And the retention incentive to be paid next December would be a bit more. It would be 273. And again, that assumes everybody stays. So all the people with 6 months or less going into this December would then be in the 1 year to 3 year category next year. So that's why that would increase the amount next year for a total, whatever you just said.
And after that, it's only gonna be one. Two beginning.
Two in the beginning, that's exactly correct. It would be to structure it so you have this December, next December, and next August. I mean, that's the end of it until the board approves future retention incentives.
Madam Chair.
Yes, go ahead.
I guess I am uncomfortable going that far down the road without proving that the retention incentive works. And that's why I ask, because I think we should see if because we've already done the dollar increase. And part of this across the board, like all the organizations that I'm involved in, everybody's trying to figure out retention. We're finding out that the health benefits don't necessarily mean retention. We don't know if the dollar an hour pay increase will improve the turnover and retention. So I mean, I'm comfortable with the first time retention bonus, but I think that we need to find out if it worked. And if it didn't work, I don't know that continuing the program is quite the right idea.
Madam Chair.
Yes, go ahead.
We could change it.
Well,
Go ahead.
I totally hear what you're saying. And then I guess you got, it's like, do you prevent something from happening? Like the turnover would have been worse had we not done it, or did it improve? And did it improve for other reasons? I mean, it's again, it's a practice that I know has gone on in the private sector for a while. So I hear what you're saying. I guess the reason I would advocate for the board to fund it for next year is just if it makes that commitment, so I don't get my money on December 23rd and see you later. Is that,
Madam Chair, may I add also that
Just,
just,
Laura, go ahead.
so we will have the opportunity next August, or we could do it prior to that to redesignate. So you'll see this as a line item on our cash balance statement every month. So in December, we'd expect to see it go down by that 250. So you'd see the balance that was there. So next August, before the second payout of the retention incentive, is when you would have the opportunity to redesignate or designate the additional year. So I understand.
Well, Madam Chair, if I may, you've already made the promise to an employee.
That's
So
true.
it makes it very difficult to redesignate. And that's why in my other side job, because I have got like 16 of these, we have learned over time that to pre-approve things down the road, they don't necessarily get reviewed, and then they just get locked into everything else unless everybody is super diligent and pays attention to everything. And there is if you get any sort of complacency, there isn't necessarily a review of the process, because it's much easier to leave it where it is than it is to check it back.
Madam Chair?
Yes, go ahead.
Completely understand. So to your first point, I agree 100%. If this board designates it for December of 2023 at that maximum amount, because that assumes there's no turnover, then we need to pay it. The fund itself, you will see every August, because it's part of our designated funds, cash carryover, and unless you approve putting additional money into that, no more money goes into that fund. It would basically go to zero. And the plan is any money left over, because it's designated at 253, comes back to the board for consideration for IT projects or anything else. So it would not just go in perpetuity without the board approving each August.
Right, if funding is available, it says.
Madam Chair. Yeah, I understand that. I understand the funding component. I get it. What I'm saying is what you're promising employees to hire and what you're promising to retain. And so you as, I've been down this road before. If you as the agency are saying, yeah, for retention purposes, you can expect these kind of retention bonuses. And then the board comes back and says, no, we're not funding your retention bonuses. That's the rub. The rub's not whether the money's there or the money's not there, or we can move money there or take money away. It's what kind of promises are you making to employees to retain them? Because board policy, like you said, could change midstream.
That's right.
But what you are doing, because I'm dealing with this right now in a different level, is you're tying the hands of the board by creating this policy. So our hands are effectively tied by you promoting this retention policy, and then we come to August, and if we find out that this isn't gonna work, that we don't have money for it, make up the cause, then you've effectively tied our hands because our promises have already been made to employees. That's my concern.
Madam Chair,
Go
I'm thinking maybe a way to solve the situation is to tie it to a formula. If you're saying you have a 20% retention loss right now, if it moves back to 10% or below, then it's not available. If it's still 11, 12, 13% loss, then we would do it the second year, but tie it to a formula. That way the employee is notified at the beginning that this is the situation. They know that if retention drops below 10%, they won't get that the second year. Does that make sense?
Madam Chair?
Yes, go ahead.
Yes, it does. And I think that would be something we could do. And then I think I'm certainly glad to share the messaging from me to our staff that this is funded. If again, if the board approves either through this year or this year plus next year, that this is not an ongoing commitment. This is for current circumstances and maybe include the formula component. Yeah, the idea, it would certainly never be my style to blame the board for, like, well, I tried and the board didn't approve it. So I think that's something I'd want to work with you or work with board chair to figure out the language, because it's not ongoing. And even in the private industry, they don't always do these. If financially they're not in a position to do it. Next August, we find out if we do the $1 an hour, and again, with economic conditions, how things shift around, or grant funding streams. If we don't have the money to do this, that's point number one. If the money's not there, I'm not going to bring it to you in August for the following December. And then if we find that our turnover rate is average, or that 10% mark, and that's typically what we've had historically, with a lot of the frontline staff accounting for the majority of that turnover, then that would end the program too. I mean, that's a great idea. But again, on the communication, I'm not going to say, hey, we're going to do this till the end of time. This is just really, given our current circumstance with unprecedented turnover, and it's funded through December of 2023, if it's approved for that, and there's no further commitments beyond that.
Madam Chair, I think counties can't do this. We cannot commit future boards to a cost. So we just do it with salary, direct salary bumps, and that way to keep folks. But if we did this on a county level, it's not kosher at all. And I don't think the state can do it either. For retention, you can't commit future boards to a fixed cost. I don't know about the health districts.
Well, you can't, Madam Chair.
Yeah, go ahead.
I said, that's exactly my point, is he can't make that commitment because this board could all be different tomorrow.
Right.
And so if that brand new board came and said, no, we're not funding it, then it doesn't get funded and promises have been made to people based upon retention
Right.
that can't be made. So that's my concern, and that's why I would fund it at this point, have a review before August, and then, then talk about it again, about another retention bonus for that year, rather than, and this is just because, and I understand that I am relatively probably more sensitive about hiding ongoing costs than other people at the table, because it happens a lot in my world. But I think that that's where my discomfort is a commitment. Obviously, the board had voted to put the money away and then to go backward on a commitment when it's that's the point I'm gonna make.
And I think, who knows, we may be looking at this for 3 or 4 more years of retention policy. Because man, we're exploding and everybody knows that. There's lots of jobs out there and we may decide, but maybe we can do this on an annual basis each year. We'll look at it like, instead of committing to that 2-year, because I kind of agree with Megan on that. You're getting yourself into some deep water here that you can't get back out.
Understood, but I don't think we should back out if you make a commitment for almost a year and a half.
But I think it's a great idea.
Yeah.
I wish we could do it on the county level.
Yeah, that's fair.
And we are looking at new board members starting the first of the year. At least one from Boise County that we know of.
Maybe they make Commissioner Sturmont and he's no longer a commissioner.
You never know. Yeah, you don't know. You know. So this is not an action item. We can't vote.
This is not an action.
Okay.
The action part of it is
To accept her budget.
Laurel's gonna, do the cash carryover, so you'll want to, the board chooses what Representative Blanksmith just described, we're gonna reduce that designation down to 254. And clear, it's just gonna free up more undesignated cash, which is fine. I mean, we need a certain amount of undesignated cash for cash flow, or undesignated cash fluctuates because of payroll and timing of now county contributions. So I just wanted to make sure that was clear. It's not like, oh, we got to figure out what to do with that 273,000 right away.
Do we want to have Laurel formulate and bring it back in October?
Or the plan as far as what Commissioner Hasbrook described?
Well, and I'm also thinking, as I'm looking at this, that we need to take some of this that's left over and put it in a reserve fund to get that fully funded. Personnel reserve fund, she's saying here we're about 17,000 short. I would like to move some of that extra into that. Because we've been through that and that is not fun either.
No, that isn't.
Well, Laurel will describe all that
Okay.
next, and I guess the question as far as, I mean, my preference is to get the money designated, where what we're talking about is the formula is not going to really impact this year's anyway. We would be coming back next year and saying, I like that idea, and I don't know, we have to put it in a policy, be like the board and I am interested in getting our turnover down to 10%. And if that's the target, I think you can suggest that so it's documented in the minutes, and then next year when we have this conversation, we'll be like, yep, we're still at 20% or we're at 8%. We don't need to do it.
Well, and I don't want to play devil's advocate, but it could go to 30%. Because of the job market demand right now, it could go to 30%. We may look at this again next year and say, we need to bump that.
Yes, go ahead, Lee.
So I would just ask maybe if Donna would put it in the minutes to review in August. So then if we just have that it has for October, so when we want to, we want to review it.
What we would review, so if the board chooses today to fund the one for this December, obviously we're not going to see any changes. So you would, in my mind, you would want to see next August.
Right.
If I come to you and
That's
say,
what I'm saying. Yeah, so like a review next August on the success of the program. If we just have it in the minutes, then it's documented under this discussion, and then we can make whatever motions that are successful or unsuccessful with the board designation.
So bring that back in. Do you want to act on any of those then today?
yes, So
Okay.
I would like to fund the 254,000 and I'm
Today-
sorry for the
today.
confusion. So it's in the next agenda item when you do
Right.
all the cash carryover.
And take out the 273.
Correct.
Yes.
And Laurel has that direction now. So when she
Okay.
presents the next discussion item and you have this in your packet, it's going to reduce that fund
Right.
down to 254 if you approve that. And then next August, what's documented, we will present to you the success of the program, basically looking at turnover and various positions and
Right.
So you'll just need a motion to that.
Oh,
She's gonna go.
sorry.
Yeah.
Go ahead and do.
I'll
her
make the motion
presentation.
as soon as she's good with her presentation.
She's good with her
I'm ready,
presentation. Laurel,
whenever.
go ahead again.
Okay, so just as a reminder, we do this, and it's stipulated by policy that we review our reserve fund designations and special projects and carryover designations at every August board meeting. As you probably recall, we have the personnel reserve, which is, as Commissioner Heswick pointed out, for the 27th pay period that occurs about every 11 years. We are on track with that. We're designating now, we're asking to designating an extra 17,000 to keep us on track. We're not behind.
Oh, okay.
Yeah, typically the point of the year where we put the extra 17,000 in.
I
So,
gotcha.
yeah, that's what we're asking for with that. The operational reserve is primarily for cash flow and emergencies. We'll talk about that. And then capital reserve again is for major facility related costs and capital planning. So I did want to point out one thing on the top of this handout, which refers to our cash on hand and our restricted committed cash. There's a new line item there that you haven't seen before, and that is the WICC implementation CDH district support for $50,000. And what we're asking for there, that's a new designation to implement the projects that come out of the community health needs assessment. So those will be used only for our district, not for District 3 and District 4, and just for the implementation of whatever projects arise from that health needs assessment. So typically you see the WICC, that line item above that amount hasn't changed, but the new restricted cash that we'd be asking for there is that 50,000.
Madam Chair, I have a question.
Yes, Megan, go ahead.
So that then commits us to whatever programs are suggested by the health needs assessment. Is that what you're saying?
I am not sure what the vetting process would be for what comes out of the community health needs assessment. I would guess that 50,000 is just a starting point towards what those projects would be, but
Madam Chair.
Yes, go ahead, Russ.
So you have the community health needs assessment that has typically been done. St. Al's did theirs, they're required by law as nonprofit hospitals. St. Luke's did their community health needs assessment. St. Al's partnered with United Way, part of their community health needs assessment process. So that's all being combined into one for the first time ever. And then the Western Idaho Community Health Collaborative members would decide, is this a project that we would do in Mountain Home based on whatever the needs are? So those have not been identified. And the point with designating this is a 10-county collaborative, and the money we would designate can only be used in Public Health District 4, so that it's not used for Project Gem County. And I think it's working pretty well as far as the process. But, and other partners like St. Luke's and St. Al's, United Way, Pacific Source, Optum are providing funding, and that money would be used across the district. This is just our part.
Madam Chair,
Yes, go ahead.
having had this battle before on the community health needs assessment stuff over the years, is it necessary to even restrict anything with the type of cash flow or with the cash balance that we have on hand? Or can it be committed based upon project?
Madam Chair,
Yes, go ahead.
I think we could do it either way. If you wanted to wait until the needs assessment's done, which she comes up, the collaborative members came up with the projects. I guess the other thing we could do is if approval of this, but make a note of the board's preferences that this money is held for District 4 to use for which C, but not authorized to spend until the board approves the projects.
I think that's a great idea. I guess sorry, Madam Chair, my thing is that, we stood this group up to try and figure out a more regional based approach, and I think they're gonna need some funds to get the help in. But I like your idea. If we at least get to look at the projects to say, hey, I think that's not good or that is good, and we would support that. The other question I have is the Regional Behavioral Health Board. I thought we kind of pulled out of that.
Madam Chair?
Yes, go ahead.
Yes, in about 11 or 12 days, we're done. So
So why do we need to budget anything for that?
Madam Chair or Commissioner Hasbrook, that is what's left over in the fund at this
Okay.
point. So we expect that to continue to be spent down. And then whatever's left at the end of this month will just go into our general
Okay.
cash balance.
At the end of this month.
This month. Be completely out of that. So you won't see
So
that as a
that's
line item any further.
September 1 is the cutoff
I
date,
believe it's August 31st.
August 31st.
Right.
Okay, thank you.
Okay, roll, proceed.
Thank you. So we'll move into the proposed special projects and carryover designations. The top two are the carryover projects from last year that we did not have expenditures for, both the completion of the remodel and the EH system upgrades. Those amounts have remained unchanged. The third item in the special projects is the employee retention set aside that Russ discussed. So if we reduce that by or reduce that to 254,000. That means that 266,000 of that would go back into the undesignated available cash balance. Just as we're thinking about funding it for this year and looking at that 254,000 mark, the board also would have the discretion to consider the amounts. Our increments right now are 500, 1,000, and 2,000, as Russ described. But as we're not funding it, there's been discussion about not funding for 2 years, we would have some discretion for you to still decide what amount goes into the 1-year funding, and then we could adjust those bonus amounts or retention incentive amounts if we chose to do so. To point that out. So again, that would move 266,000 down into that undesignated available cash balance. If that's what the motion is. The 3 items in the reserve fund designation are typically what we see there. The top one increases by 17,000 for the 27th pay period, as we discussed. The operational reserve fund did get up to a high of 4.1 million. We would like to propose reducing that to 3.1 million, which puts us right about at our 3-month cash flow balance, which is what the target has always been. Last year we put more into it, but we would like to get back to that, what the board established as the amount we'd like to be at. And then you will notice that the capital reserve fund, we're proposing an increase of $500,000 for future capital needs. That would put a total of $1 million in our capital reserve fund. And part of the reason for that switch is that we are anticipating some rather large costs over the next couple of years, such as the roof on this building. That's the big thing that comes to mind. We're over the 30-year mark. We don't have that planned as a project yet, but we are just knowing the age of the building, the age of the roof, anticipating that we will have some other expensive capital projects and would like to designate in that fund. So that is the summary of our carryover and reserve fund proposal, and I'll open it up to discussion.
So Madam Chair,
Yes, go ahead.
I am ready for a motion if you're ready to hear one.
I am ready.
I would move to approve the proposal with 2 exceptions. I would remove the 50,000 for the WIC implementation and cut the employee retention down to 254,000. And if I can speak to my motion. I think that because WIC is a cooperative group and because these dollars are tax dollars and this board has a specific responsibility to people to spend those dollars and not in the interest of other entities, but simply in the interest of Central District Health. I think that it's important that we not cede that sort of spending well, we're not ceding the spending authority, but cede the prioritization of projects to another organization. So I would just like to see that removed. I think we have enough of an undesignated available cash balance that whatever projects that are proposed by the Community Health Needs Assessment can be addressed.
Madam Chair,
Yes, Raul, go ahead.
I second the motion.
The motion has been made and seconded. Is there any further discussion before we move ahead for a vote?
Madam Chair, I have a question.
Yes, Al.
So then the WIC group will come to us with projects and say, we need X amount of dollars for these projects, and we would approve or deny those.
Madam Chair,
Is that how it's gonna work?
I would do that.
You would do that?
Yeah, which see, and to be clear, I mean, these are gonna be investments in our four counties. That's part of this conversation. I totally get where Representative Blanksman's coming from, and I think it would be a matter of, once the community health needs assessments done and the collaborative separate entity comes forward with proposals, where it would ultimately be me saying, yep, I agree with that, or I don't, and I'm gonna bring that to the board for approval.
Okay, any further discussion? Okay, now we will move for a vote by county. Dr. Young,
Jane, aye.
Raul Labrador,
Aye.
Dr. Cole,
Aye.
Boise County is absent. Elmer County Representative Blanksmore,
Aye.
Valley County.
Commissioner Hasbrook, aye.
Okay, that motion does pass then.
Thank you.
We are getting close to the end of our agenda. Would you like to take a quick break right now? What's the flavor of the board?
I'm always
Go ahead.
power through.
Go ahead or go on.
If people
Go
need a
ahead.
break.
Go on.
Good.
This shouldn't take
Okay.
long.
All right, okay. Okay, Laurel, go ahead.
Okay, so on to the final handout, and if Dustin could pull that back up, although there's not much to discuss on it since we're only 1 month into the fiscal year. So this is the budget to actual report for July of 2022. We are 8.3% of the way through the year. You can see that our revenues are coming in at about 9%, so just over, and our expenditures are again under as the trend we've seen since I've been doing this job at 6%. But as you know, we're so early in the year that those trends aren't, we can't quite call them trends yet. We're just looking at the numbers so far and they're where we'd expect them to be. You see some fluctuations off of those expected percentages, and there's a operating expense at 15% in support services, and that's just due to some purchases that we've made. The one thing I did wanted to point out on the format of this report, which is what you'll be seeing going forward. So it looks a little bit different if you compare it to the year-end report. We have an extra column in the expenditures, which is the trustee and benefits. And so that the auditor also analyzed us, including that trustee and benefits category. That was one of the first times we'd heard about it or been using that term, trustee and benefits. And then for our budget for this year, we also designated a column for trustee and benefits. And as a reminder, that's just funds that we're subgranting out to other agencies. Several years ago, we weren't doing it frequently enough to represent it as its own category. But now that we are, and now that it's in our budget that way and the auditors are looking for it, we want to make sure that our reporting to you is consistent with that. Sure. So you'll see that extra column there. And that we're showing 2% so far, and that's just going to, we do a lot of subgrants at the beginning of the year, so we may not expect to see that evenly spread out month by month over the year. It'll depend on when those subgrants are paid out. So can continue to see that as we go forward with our budget to actual reports each year. And then moving on to the second page here, and again, nothing big of note, looking at the comparisons of the last 2 fiscal years where we were 1 month in, continuing to trend slightly up with our fees, also up with contracts. And as Russ mentioned, we did just get a $2 million HRSA grant for continued opioid response in Valley County. And we are expecting to hear news back on a couple of more grants we've applied for recently. So even as we're coming out of the receipt of COVID funds, we are expecting our contracts amounts to continue to go up, and we should have some good things to report on as the fiscal year continues. So that is a summary of that, and that brings me to my conclusion, unless there's any discussion items based on that.
Any discussion, questions, Joel?
Madam Chair, just a
Yes.
quick question because I'm getting a lot of calls from folks about the fentanyl issue. Are we doing anything on that?
Sure.
Yes.
Yes, so that, I mean, we're not obviously involved in Governor Little's working on and law enforcement, but just more working with the communities, and also with, it's a powerful synthetic drug, causes overdose deaths, so it's basically included in our opioid response. So the money that Earl just described, plus we got the $253,000 from the initial settlement. That's for the next 18 years. One of the grants we applied for is medication assisted therapy, where Central District Health would be, our staff would be able to provide that to
Oh, good.
not only Ada County, that grant, I can't remember, it's a very large dollar amount.
It is a large dollar amount, and that one's actually focused on rural counties. So yeah, we looked at Elmore, Valley, and
Boise
Boise.
counties.
And I think our MAT provider up there passed away, so
Yes.
we are short right now.
And we had tried to work with a local provider in Elmore County, but didn't appear to be able to move forward. So we thought we'll just apply, and we have capable staff here to provide services and be able to do it through, whatever we can do through telehealth, and then also be able to provide services directly in the community. But it's a serious problem.
Well, I'm just wondering if maybe I can use the rock and get those guys to do some more marketing to younger kids, because now they're making it in different colors. So it
Candy.
looks like candy. And we've got to figure out a way to notify schools to be on the lookout and that kind of stuff. So I'll work with Rock up there. See if that-
Right.
But that's a whole nother issue.
And we'll be working with the schools,
Okay.
prevention, education. So we know it only goes so far.
School starts Monday up there, so that'll be a good time to get that up.
Yeah.
Moving on, there's some more discussion points for Laurel. We move to the director's report by Russ.
Thank you. So the only thing I had is the discussions that are taking place right now around the food establishment license fees. And those were first established in 1997 at $55 per food establishment. Didn't matter what size the facility was, from a hot dog vendor to Costco, thinking about who we inspect. The fee was increased periodically through the years that have gone by, and including some additional fees like plan reviews that were authorized. And then the Idaho Association of Local Boards of Health at the June 9th meeting approved a resolution, and the resolution is to take the fees out of Idaho code and move that authority to the local boards of health to set the fee, like you do for most environmental health programs and like you do for medical services, mental services. So that is moving forward, or, the usual analysis by the health districts to show what it cost us to do inspections versus what we collect in fee revenue. For our district, we put in about $700,000 of county money to be able to meet our statutorily required obligation of at least basically one annual food inspection for each of these establishments. And of course, we have complaint inspections and follow-up inspections that contribute to the overall cost of the program. So Commissioner Hasbrook, as our executive council member, will be involved in those discussions. I saw did you get the notice for the?
Yeah, I think it's in September here pretty quick. We're gonna have a meeting to talk about that.
To strategize on what that might look like. I mean, very simple terms, not simple to do, but simple as you basically eliminate the license fee out of Idaho code. And then next May, we would come to you and you would see what our proposed cost would be for the licenses and the various services we offer to food establishments. in our district. So I don't know if you have anything else you want to share on that.
Terry, yeah, I do. There's a lot of issues with this because each district charges a different rate. And so if you're a Subway in Ada County versus a Subway in Bonner County, it might be a different fee. And those are some of the concerns we're trying to figure out. The other issue is we want to tailor it kind of like we do the septic permit fees, where it's our cost plus 5%.
Madam Chair.
Go ahead, Chris.
So for our fees, we set them based on actual cost. We don't have an exact formula, but we look at what our cost was this past year. We would look at, potential increases, but it's not a formula of 5%. So we charge no more than our actual cost. That's essentially how we set all our fees.
Well, and that's been some of the discussion is, how do we set those fees? And we're going to have to prove that this is our cost, plus we need a 5% admin fee to add on to it, just to create a little buffer there. But if you look at it right now, we're subsidizing private business $700,000 a year
In our district alone.
in our district alone. Other districts, it's as much or more. And it's the last thing to come out of that bill that hasn't been fixed yet. And so we're having discussions about it. We might not go anywhere, or might go somewhere really fast. Just depends on the attitude of the legislature, but I don't think it's gonna be fast, especially on an election year like this. But
Right.
we're kind of waiting until after the elections to really push this out. Start the discussion on it. To me, it makes sense where the counties now are pretty much in control of all the health districts, so we want the ability to be able to do that function as well.
Mhm.
I was looking up the next board meeting date. So
Oh, okay, thank you.
it is
October, what?
21st,
21st, okay.
October 21st?
8:30. Same building, same room. Just checking my text.
Not to start, okay.
So, yeah, so that's all I have for today.
Okay, thank you.
And I do, just want to express my appreciation for approving $1 an hour pay increase for our staff and, the retention incentive for this year. It's been, it's a challenge because, as you know, with staff turnover, somebody has to pick up the slack. So it puts a lot of burden on the other staff, and then you bring somebody new on, and there's a lot of training involved, and I'm hopeful this will create a little bit more stability than what we've had in the past. So thank you for your support of that.
That's all?
Yes,
You're done? Okay.
I can.
Okay, this brings us to the conclusion of our agenda for today. So at this point, I will call for a motion for adjournment.
So moved.
Thank you, Megan.
Second.
Thank you, Al. I'm going to go ahead and call for a vote by county, starting with Dr. Young.
Jane Young, aye.
Rel Labrador,
Aye.
Dr. Cole,
Aye.
Boise County is absent. Elmore County Representative Blanksmall,
Aye.
Valley County Commissioner Hasbrook.
Hasbrook, aye.
Okay, motion for adjournment passes, and I want to express my appreciation for the folks that have shown interest and attended the meeting today, as well as those who have participated remotely. So have a good remainder of your summer, and our next meeting, as we just stated, will be October 21st at 8:30 a.m. Thank you.